Am I okay to go ahead and share the screen now?
You go right ahead, Brenda.
Yes.
Okay, thank you. And let's go here. There we go. Can everybody see that okay?
Perfect.
Yes.
Yes, we can.
Okay, well, first of all, thank you so much for having me. It's nice to be back with you. I have met a few of you at previous meetings, so it's nice to be back. And I'm very excited to be here today and tell you a little bit about Gift of Life International, which, as you know from listening to my bio, is really what I feel is my purpose in life now after having my own daughter be born with congenital heart disease. So I feel very blessed to be able to do this work. And it's wonderful that this is the work of Rotary as well as Gift of Life. So I would just start by saying that I don't know how many of you actually know about Gift of Life, but you actually do have a Gift of Life program in Rotary District 7090. So Gift of Life International is actually made up of 84 affiliated programs in 80 countries around the world. Our base is in New York, but we are in 80 countries around the world. And in District 7090, the chair of the cross-border Gift of Life program is Valerie Phillips, who lives in Hagersville. So if any of you are not aware of Gift of Life, you do have one very close by. And now I am also here. So you have more than one person that's very invested in the program itself. So I will go through and just share a little bit with you today. So right here, you see one of the children that was just operated earlier this month. This is little Ismail. He's 2 years old. He just had his heart healed during our January surgical visit to La Paz, Bolivia. When I got this picture, I was just blown away. He's just the cutest thing ever. And to see these kids, you know, that are so sick and then they have their hearts healed during one of our trips is quite amazing. So as you can see there, we have our mission statement up there. And it is to provide life-saving cardiac treatment to children in need from developing countries, regardless of gender, creed, or national origin. Our goal is to develop sustainable pediatric cardiac programs by implementing screening, surgical, and training missions, which are supported by autonomous Gift of Life programs, Rotary Global grants, and generous donors from around the world. Let me see, I'm going to go to the next screen here. There we go. So I don't know how many of you are aware, but congenital heart disease actually is the #1 birth defect worldwide. It is more prevalent than any childhood cancer or any other childhood diseases. Globally, there's over 1.3 million children born with congenital heart disease. 93% of those children have no access to care. And approximately 50% of that 1.3 million actually need some sort of intervention to be able to survive. So it is definitely a crisis around the world. It's one that we're doing our best to treat as many children as we possibly can before it's too late. Many of these children go undiagnosed because they don't have cardiologists in the country where they live that can diagnose them. Many of the pediatricians, if they have those, are not able to detect the heart defects. And actually 6 weeks of age is a critical point for children with a heart defect. And if it goes undiagnosed beyond 6 weeks of age, many of them unfortunately pass away. And others start to be seriously affected because the condition of the heart affects other organs in their body, and they struggle and ultimately perish if they don't get the treatment that they need. So the work that we do with Gift of Life International is focused in emerging countries around the world. As you may or may not know, if a child is born with a heart defect in the United States or in Canada, they will receive the care that they need. It gets diagnosed very quickly, sometimes even before birth now. But in the countries where we work, in emerging countries, that's not the case. And many of them don't have access to care. The diagnosis is not done. And I will tell you firsthand that I have personally seen where a parent brings their child to a hospital in an emerging country, the doctors don't know what to do, and they literally tell them to take their child home and let them die in peace. So if you can imagine that as a parent or a grandparent, you can understand why we do what we do. Here in this picture, you actually see Mrs. Sam Awari. I'm sure you know of Sam Awari, who was the Rotary International president-elect who passed away. And Mrs. Awari is sitting here with some of our Ugandan Gift of Life recipients. I'm just going to go through this slide a little bit quickly, and we'll get into some of the details a little bit more as I go through the presentation. But this is a little bit about the evolution of Gift of Life. In 1975, there was a Rotarian in the Manhasset Rotary Club. His name was Robbie Dono, and he was a young guy at the time. He was in his early 20s, and he was at his regular Rotary meeting, and somebody was talking about a child in Uganda that needed help, needed heart surgery. And he was sitting at his Rotary meeting, and he was fairly new to Rotary, and he raised his hand and he said, "How can I help?" And long story short, that child, her name is Grace Ogwaru, and she was 5 years old at the time. And Robbie put together another group of Rotarians and some healthcare professionals in New York, was able to get Grace to the United States. She had her heart surgery and went back to Uganda. And today she actually works in our program at the Uganda Heart Institute to help other children in Uganda now. So that was the first child ever treated through the Gift of Life program. It started in the Manhasset Rotary Club in 1975. Then in 2003, Gift of Life International actually was formed. And Gift of Life International was formed as an umbrella organization to help maximize the impact of all the Gift of Life programs around the world, which are primarily based out of Rotary clubs and Rotary districts. And it just allowed us to do more to help more children. At that time, and up until 2008, when you see that we treated our 10,000th child, which was 33 years after we started with the first child in 1975. During that time period of 33 years, we actually were just helping one child at a time. And most of those children, honestly, were brought to the United States, a few to Canada, a few to European countries, but they were basically treated one child at a time, and the cost was quite high, not only for the travel, but also for the treatment of the children. And then when they were stable and had their hearts healed, then they would go back to their homes. So at the end of 2008, for the first time ever, Gift of Life International hired a CEO, which is still our CEO, Rob Railman. And Rob came in and he looked at what was happening and decided that there was things we could do to maximize our impact and treat more children around the world. So he created this new strategy, and the strategy basically was put in place to develop sustainable pediatric cardiac programs in emerging countries around the world. And with this strategy, we have made tremendous strides in treating more and more children every year around the world. So in 2009, the first, what we call our Hearts Are In program, was implemented in Kampala, Uganda. And in 2010, that same Our Hearts Are In program was implemented in San Salvador, El Salvador. So what we did is we poured in a tremendous amount of resources into those programs. We would focus on training local healthcare professionals. So we would put together teams of healthcare professionals from some of the leading pediatric cardiac facilities in the US, Canada, and Europe, assemble teams together and send them to the countries that we felt had the resources, not only the resources, but the personnel and the desire to start the implementation of these sustainable pediatric cardiac programs. So over the course of the next several years, we focused most of our efforts on the development of these programs. And in 2018, we actually moved 2 of those programs, the first 2, Uganda and El Salvador, to what we call legacy programs, meaning that they now were sustainable on their own. And they were treating children in their own country on a reliable basis. Then moving forward into just pre-pandemic 2019, we actually had our most impactful year that we had ever had in Gift of Life. We treated 3,600 children in 1 year around the world, and we actually completed 28 training visits around the world. So that was a remarkable year for us. We actually had hoped to increase that number to 4,000 in 2020, and then the pandemic hit. But the thing that we are very, very happy to report and very proud of, honestly, is that we have not stopped treating children throughout this whole pandemic. We have found ways to continue. We have COVID protocols in place for all of our teams, and we continue to treat children. And I will go into that a little bit more as we go through the presentation here. But one of the great accomplishments that we have achieved is in 2021, last year, we actually reached our milestone of treating our 40,000th child. So you can see where the strategic approach of developing sustainable pediatric programs in countries has really maximized our impact, because it took 33 years to get to our 10,000th child. But then in just the last 13 years, we went from 10,000 to 40,000. So our strategy is definitely working. We're making an impact with children with congenital heart disease around the world. And we hope that, as we hopefully make a little detour out of this pandemic, that we can get back to the numbers that we were achieving before. Okay, Rotary. As I said earlier, this is a Rotary-based program, and Rotary Global Grants are a big part of my job, of what I do, and they have been a major funding source for the impact that I just mentioned to you of helping all of these children around the world. So we work with Rotarians around the world, with Rotary clubs, Rotary districts, individual Rotarians, and we actually have been successful in writing and having approved over $13 million worth of Rotary Global Grants since 2013. We have supported 19 of our programs in emerging countries through these Rotary Global Grants. And over 8,400 children have been treated as a result of those Rotary Global Grants. So it has been a tremendous support to our programs, has really raised awareness throughout Rotary and throughout the world of not only the impact that Rotary is able to make, but also the impact of these programs and how Rotary can, seriously change lives and heal these little hearts around the world. So this has been a blessing to Gift of Life International. As I said earlier, almost all of our affiliated programs are born out of a Rotary club or a Rotary district. We do have a few that were not, but the majority are. And these Rotary Global Grants have actually been supported by 324 Rotary clubs and 77 Rotary districts around the world since 2013. And that number continues to grow as we continue to do more Rotary Global Grants. So as a Rotarian, I'm very proud that Rotary has made this huge impact and helped us save the lives of so many children around the world. You can see all these precious faces on the screen from all the different countries. And that's just a very small representation of all the lives that have been saved. So our program, our strategy that was developed in 2009 to develop sustainable pediatric cardiac programs has now resulted in 3 legacy programs. And those are in Uganda and El Salvador, which were started in 2009 and 2010. And then we just added in 2021, actually, we added Romania to our list of legacy programs. You'll see in this picture here inside the operating room in our program in Romania. The government there actually partnered with us and built a brand new state-of-the-art pediatric cardiac unit in one of the hospitals there. This is inside the operating room. All of this equipment was provided by the government in Romania, and we also have a state-of-the-art ICU there. So this program in Romania was actually, the development started in 2016. So it was really fast tracked by the pandemic. And one of the things that, is a huge positive that has come out of the pandemic is all of the work that we did in the previous 10 years of training all the local healthcare professionals, upgrading all the equipment in the hospitals where we're developing these programs, and really securing vendors of the medications and the highly specialized supplies that are needed for the pediatric cardiac surgeries. All of this helped us so that we could continue to have children treated around the world when the world shut down. So programs like this one in Romania that we were still training in, but they were close to being sustainable, really took the initiative and realized that just because COVID hit and the world shut down, the children don't stop being born with heart disease, and they don't stop needing this critical care and treatment to save their lives. So they really stepped up to the plate, and they used the skills that they had learned thus far. Our visiting teams have done a lot of mentoring virtually to some of these teams and helped them and advised them on things. But really, the pandemic has really motivated and empowered local healthcare professionals that had received training from our teams to step up to the plate and really begin to do this on their own, and they're doing it successfully. And it really has been a wonderful outcome from the pandemic, is that we've been able to continue to treat these children. So a legacy program is a core program that has succeeded, and it has the full backing of its local government, the hospital where the program is located. The team has now been fully trained over a course of several years of having VTT training teams go in that we put together through Gift of Life. In most cases, we've had to upgrade the equipment and the facilities in the hospital. Like I said, in Romania, the government did that for us. But in most cases, especially in Uganda and El Salvador, the way we were able to do that was with those Rotary Global grants. So we were able to upgrade and give them state-of-the-art equipment in their operating theaters and their ICUs, so that the children could be treated with state-of-the-art equipment, and with that in turn improve the outcomes of these complicated surgeries. And basically the legacy programs that we list here, they are now treating children independently on a sustainable basis. So week after week, they're treating children. Even throughout the pandemic, they were putting themselves at risk. We made sure they all had the proper PPE, and they would go in and they would treat the children whenever possible. And so, as I said, we have not stopped treating children throughout the whole pandemic. What is a core program? So we have two programs right now that are our core programs. One is Jamaica, and our newest one is Bolivia, that we're just starting to develop. The picture you see here is actually was taken last week in Bolivia during our training visit there. We had not been able to go to Bolivia for the past 2 years, and we just were able to go back now, and you'll see one of our Gift of Life nurses there training the Bolivian nurses at the bedside in the ICU. A core program is a program that we feel warrants the strategic development of a sustainable pediatric cardiac program. So we pour in significant resources into these programs. Once they're selected, we do, regular training visits to these programs. We help them to develop country-specific protocols. It is something that we've learned, that you have to be able to adapt to each country, the resources that they have, the needs that they have, and develop the protocols accordingly, because developing protocols for one country the same in other countries doesn't necessarily work, because from country to country there are such vast differences. So the basis, of course, is the same, but then we make them country specific so that they can be successful in their own environment. And really the basis of this is the empowerment of local healthcare professionals to treat the children in their country of birth. And that's how we maximize the number of children we're able to treat now, because the children are no longer having to travel outside their country to the United States or Canada, but they're being treated in their own country. So this basis of the core programs is what was developed in 2009. It is definitely working for us in many of our countries. And the reason that we have been successful is that a criteria was put in place when we first started this development. And this is the criteria you see here. So in order to be considered for a core program, the things that we look for when we go in to do an evaluation of a particular country is there must be a supportive and an invested government. We need a government that we can work with, because in turn, in order for them to be sustainable, you need to have the government's support. There has to be a motivated and involved hospital administration in the hospital where we're going to develop the program. We must have a strong partnership with the hospital administration and with all the healthcare workers in that hospital. To develop a program like this, there must be a buy-in from everybody. They must want the program. They must be motivated to work towards making it sustainable, and we will partner with them when we see that present. There has to be an established pediatric cardiac surgery program in place. It doesn't mean that they're doing very many surgeries. It doesn't mean that their success rate is very good, but there has to be some components of a cardiac team that has been trained, which gives us the opportunity to take our teams in there and actually do training. If there's no trained physicians already, we don't have the ability to go in and train them. They have to have that the med school training to start with and have some sort of a program in place. I'll give you an example here. This is a picture you see in El Salvador. The lady standing up in the middle happened to be the Minister of Health at the time this picture was taken. You can see a Rotarian on one side of her. We have a very strong Rotary presence and support in El Salvador. On the other side of her is the director of the hospital where we have our program. And then on the other side of him is a young lady who happens to be our executive director in El Salvador for our affiliated program there. The support of the government and the hospital in El Salvador has been overwhelming since we started the program there. And now they are at a point where they don't really need us anymore, because the hospital administration really advocates for the pediatric cardiac program. They have an in-country NGO in our affiliate there that supports them and helps to make sure that all the supplies and medications are there for the team on a regular basis. They follow up with each patient to make sure that each patient has adequate care. If there's any issues that come up following surgery, they refer them back to the hospital for follow-up visits. And the government has now really invested in this program. As a matter of fact, they're just about to open the first ever catheterization lab in the public hospital where we developed the surgical program. And that's all being funded by the government now. We poured in a tremendous amount of resources into El Salvador over the years. We upgraded all of their equipment in the hospital. We provided a tremendous amount of training. And now they're doing it on their own. And that's really what the idea is of this whole program, is to make each one of these countries sustainable so that they can operate all the children with heart disease in their country of birth. And it's working. So just in the legacy and core programs that I just mentioned, we have treated over 7,000 children in these programs since 2009. That's 17.5% of all the children that have been treated through our global network since 1975. So again, this is just another indication that this development of these sustainable pediatric cardiac programs so children can be treated in their country of birth is actually working, and working very, very well. This cute little girl on the screen here is Rhea. She's 3 years old. She's from Pristina, Kosovo. And she actually is our 40,000th child to be treated since 1975. Just an adorable little girl. And she, like I said, lives in Kosovo. And Kosovo is one of what we call our countries of focus. So there are many, many countries around the world that do not meet our criteria to become a core program. However, the need for pediatric cardiac care is just astronomical. It's overwhelming, to say the least. And so you can see the list of countries up there that we consider our countries of focus. There's a dire need for help in these countries. They do not meet the criteria for a core program. Eventually over time they might, but right now that they don't. And so we work differently in each one of these countries. What we do is we go in, we do an evaluation, we decide what resources are available there. What are we able to accomplish in some of these countries? We do take training teams in. They have a partial team, not a full team. So we're working with the partial team that's there to train them. And then with the hopes of, hopefully someday we'll be able to complete that team and then continue the training. But at this time, the focus in these countries is just to try and help as many children as we can before it's too late, before they become untreatable. And so we work, like I said, differently in each one of these countries based on the need that's there and based on the resources that are there for us to work with. But this does help us maximize our impact to help the children around the world with congenital heart disease. And so this is an avenue where we can help without having to follow the strategy of the development of the sustainable pediatric cardiac programs in our core and legacy programs, while we're still offering care to these children that need it. Pandemic. So this little girl, Rico, she's a 3-year-old girl from the southern region of the Philippines in an area called Cebu. This is really a great Rotary story here. We have 2 programs in the Philippines. One is in Manila and the other one is in Cebu, like I just mentioned, in the southern region of the islands down there. And we had been working to move Cebu to a core program. And then when the pandemic hit, that all stopped because we were no longer able to send teams there. And the hospital that we were considering developing a program in became a COVID hospital. So all the pediatric cardiac surgeries and any development of a program there stopped very abruptly in March 2020. However, we get more requests for help from Filipino parents than any other country in the world, and the need there is tremendous. So we do have a program in Manila where we are actually operating on children with the local healthcare professionals there. So the Rotary Club of Cebu worked together with the Rotary Club of Makati West in Manila, and together with Gift of Life and our CEO's strategical input, what we ended up doing is putting in place protocols so that these children in the southern region were able to travel to Manila. Some went by boat, some went by plane, and they all had to dress like this with their masks on and their face shields on and whatever protection that we could give them. And they traveled to Manila and they were operated in Manila during the pandemic. We're still doing that now. We're actually in the process of writing another global grant to continue this because the need is so tremendous that we want to be able to continue helping these children. We just can't leave them without any care in the southern region of the Philippines. So throughout the pandemic since March 2020, you will, there's so many stories that I could tell you, but we have managed to help over 3,600 children from 24 countries since March 2020. And we actually have been able to complete 16 training visits to various countries as well. That has been quite the challenge, to be honest, with all the travel restrictions and flight cancellations and what have you, and testing requirements and everything. We also have put in our own COVID protocols with our teams. So it has been a challenge, but we've been able to do that very successfully. We're very proud of that. And we continue to do that. So where we are able to, we continue to train the local healthcare professionals. And as I mentioned earlier, the pandemic has really empowered those that we had already provided training to treat children in their country of birth. And that's part of that 3,600 number, is they've been able to treat them in their own countries without our training teams going in. And then also, as I mentioned earlier, throughout the pandemic, we were able to move Romania from a core program to a legacy program. And little Rhea was celebrated as our 40,000th child treated also in September 2021. So the pandemic may have stopped some things, but it certainly has not stopped us. So we're very happy that we've been able to find ways to continue helping children, and we hope to increase that number further as we go through the next few months and 2022. We also have a fairly new program that is really very exciting and groundbreaking, and that is our rheumatic heart disease program in Uganda. Up until now, everything that I've told you about is, I'm sorry, my dogs are barking a little bit. Everything I've told you about until now is focused on congenital heart disease. So in Uganda and some other developing countries, one of the major health concerns is rheumatic heart disease. And that is an acquired heart valve disease that's caused by untreated strep throat. So as you know, if you have a child here in Canada or in the United States and they don't feel well, you take them to the pediatrician. If they figure out that they have strep throat, they're given a round of antibiotics, and usually that makes it go away and they're fine. Well, in these countries, specifically here in Uganda, children go untreated with strep throat and it becomes heart disease, rheumatic heart disease. So something that could be treated simply with some antibiotics or with some penicillin becomes life-threatening, and many, many people die from it. As a matter of fact, it affects 40 million people around the world. And it's something that can be prevented with something as simple as penicillin. So we work together with a doctor at the National Children's Hospital in Washington, D.C., and he has done a lot of research on rheumatic heart disease, and has, together with Gift of Life International, implemented a screening and treatment program in the northern region of Uganda. And so now we have screened well over 100,000 children. We've gone out remotely to schools and various locations, to some homes, and we've been able to screen all these children. And we now have over 1,000 children being treated monthly in Uganda on both a preventative treatment plan, and also those who have shown mild symptoms of rheumatic heart disease. As long as we get the diagnosis early on in the disease, just a simple monthly dose of penicillin will help the disease so that it does not advance. And so this preventative treatment of monthly penicillin shots, which costs very little, will save the lives of literally hundreds of thousands of people. And we're only treating children up to the age of 21 right now, because that is what our focus is. But it's really a groundbreaking effort that's going on here. Children that have advanced rheumatic heart disease are now able to be treated in our program at the Uganda Heart Institute, which is one of our legacy programs. So this is something that we feel we will be able to expand to other countries that have the same crisis going on with rheumatic heart disease, but it's fairly new for us and we're very excited about it. Okay, go to the next one here. All right, so you may be asking at this point, that's a lot of information to absorb. You may be asking how you can help. Well, one of the ways you can help is to donate to one of our Rotary Global grants through your Rotary Club. As I said, we're in the process of just completing one right now to support the program in Cebu. We're hoping to finalize that actually within the next week. Still could use a few more funds for that one to finalize that. You can support the rheumatic heart disease program directly as a Rotarian or as a Rotary Club or Rotary District. That one we are supporting right now without Rotary Global grants. But there are opportunities to support that. You could sponsor a child for surgery directly, or sponsor a child for nutritional assistance, which is another program we have that I didn't touch on yet. You could host a fundraiser in your Rotary Club and donate part of the proceeds to Gift of Life, or just simply follow us on our social media. We're on all social media platforms, Gift of Life International, and help us raise awareness by following us and sharing our posts. So there's a lot of ways that you can support us. We appreciate everything that anybody does to help us to raise awareness and raise funds, because the more that we're able to do, the more children that we can help directly. I have a 2-minute video. Do I have enough time, or would you like me to stop and take questions at this point?
Brenda, would you mind taking questions first and see how many questions there are, and then
Sure.
and then we'll finish with the video. Just
Sure.
Sometimes we're a chatty bunch.
Yeah.
Just want to
happy-
make a note that I muted a bunch of people because we were getting feedback. So if you thought you're unmuted, you're not.
Yeah, I'm happy to take any questions. And then if we have time, I can play the video. If not, that's fine too. Maybe I'll stop the share right now, just in case. It might be easier to see people that way.
Thank you.
Jim?
As a club, have we heard of this program through the district?
So we really heard about this program when Brenda came to our meeting last November, when we met in person at the Legion, which was a one-off. So I admit I was not familiar with this program until I met Brenda myself. I don't know if anyone else has.
Thank you.
Well, we'll have to change that.
Yes. For sure.
Any other questions?
Brenda, I'm trying to understand why young kids are getting this. Is there something preventive that has to be done?
No, as a matter of fact, that was the first question that came into my mind when my own daughter was diagnosed with congenital heart disease. There is no known cause. I mean, obviously, if there is a mother that, you know, has had drug abuse or alcohol abuse or anything like that during pregnancy, that can definitely cause this type of thing. But 99% of the time, they don't understand the cause of it. They don't know why. It's just something genetic that happens. So no, it's not really preventative. But now with all the advances in medicine and cardiac surgery, the majority of children in the developing world are operated within the first week of life.
And what's the success rate if they're operated on immediately like that?
Well, in the developing world, the success rate, I believe, is in most major programs is around 5% or less mortality rate. I don't know, specifically by programs, but I will tell you that with our training programs that we have in place, we're very proud to say that in our emerging countries where we have our core and legacy programs, every one of those has less than a 5% mortality now as a result of the training. Before the training, just as an example, our program in El Salvador, they used to operate, I believe it was 35 children a year. They're now doing almost 200 a year. But when they were doing 35 a year, their mortality rate was over 25%. And the Minister of Health had asked them to stop operating because they were actually killing more children than helping. Now they're operating almost 200 children a year with a less than 5% mortality rate. So their success rate in these emerging countries equals that of developing countries, which is remarkable.
Brenda, the countries that are not yet on your list as far as being an approved country, if that's the right term, are they reaching out to you, or do you have people on the ground that are researching countries that are without the service and in need?
Great question. In most cases, people reach out to us, and honestly, in most cases, it comes through Rotary. We usually have, a Rotary club or a Rotary district that hears about the program somehow. And they will reach out to us and say, we have a tremendous need in our country. Can you come and see if it's possible to develop a program here? And then our CEO, Rob Railman, he'll go and he'll check it out and he'll decide, does it have the basis? Does it meet the criteria for a core program? Or is it one that we can even consider for a country of focus, and how can we work in that country? And in some cases, when we've gone in and done that evaluation, we've decided that we can't do either. And so in that case, what we'll do is we will figure out how to take children from that country that are still treatable and take them to another nearby country where we do have a program and have them treated there. We just actually finished a Rotary Global grant where we took 10 children from Nigeria and sent them to India. And they were all treated in India through a Rotary Global Grant. And that was all done through the cooperation of Rotarians with Gift of Life.
Oh,
Brenda, I found this presentation absolutely fascinating. Actually, two of my daughters were born with congenital heart defects. The youngest had heart surgery on the day she was born.
Oh.
And she's turning 30 this year, and doing quite well, although has annual follow-ups. But my oldest daughter just found out this past year she also has a bicuspid valve. So I think a lot more people have, like, quite interesting. You said it's very common. I think a lot more people have congenital heart defects that may or may not even be aware of them. So some more minor than others, but quite a fascinating presentation. Thank you so very much for the
Thank you.
information.
Thank you. That actually does happen, like people don't realize that they were born with a heart defect of some kind. As I mentioned earlier, there's about 50% of the population that is born with some sort of a congenital heart defect that needs surgical intervention or catheterization intervention. So some don't need it, but then later on in life, they may actually find that they do need it later on. Mhm. Anything else?
Brenda, do you know of any clubs in our district 7090 that is actively supporting Gift of Life right now?
The only one that I know, and forgive me because I haven't talked to Valerie Phillips that much since I've been back, but she is a Rotarian in a Rotary Club, I think in Hagersville, where she lives. And so they obviously support it, and they have Rotary clubs down in that area and then across the border as well that are part of her Gift of Life program. So yes, there are some, I'm not sure exactly which ones, but I think they tend to be more down that way towards the cross-border area.
Okay, good to know. Any more questions for Brenda?
It does appear that our district itself does something. I just did a quick search. So the district as a whole supports it.
Okay, we'll look into that then.
Yeah.
Okay, if there are no more questions, Norbert, I have you down as the official thanker.
Yes, let me turn on the, can you hear me?
Yes.
Wow. I'm so happy that I was selected to thank you, Brenda, for visiting us and give us this enlightening speech. You are amazing ambassador for this organization and the amazing work that this organization does. I really don't know anybody who was actively instrumental in saving 40,000 lives of children. It's sure heartwarming to hear your presentation. We are lucky to live in the best country in the world that we do not face these problems. And thank you for bringing attention the problems of some others that are less fortunate than us. And it gives us a duty to help them. And I'm sure that our board will examine how can we be instrumental in helping your organization and make some difference. So once again, thank you very much for coming, and hopefully we will see you soon. Thank you.
Thank you. It's a pleasure to be here. It's nice to have all of you with me, and I'm happy that I was given the opportunity to share more about Gift of Life. Honestly, I could go on with stories about the children for days. So
thank you. Thank you, Brenda. And thank you, Paul. Paul has put in the chat a link to the district's website. I'm looking here, Paul, which has some stories about Gift of Life. Is that correct?
That is correct. I saw two.
Okay, so check those out.